Hi, I'm Dr. Lawrence Grunfeld, and the topic for today is reproductive options in the LGBTQ community. So I'd like to divide this into the different types of patients that might show up for reproductive options. The question is, why would somebody who's not infertile, who simply needs assistance becoming pregnant because they don't have the anatomic organs themselves to complete the process, have to go to a fertility center? They're not infertile. Well, currently most third-party parenting is done through fertility centers due to the complexity of the technology and also due to some regulatory oversight that only fertility centers are able to be competent with, that will allow proper, safe use of third-party parenting. So let's divide it up into different communities. Let's start with the lesbian community. Well, obviously the lesbian community will need a third-party source of sperm to become a parent with. Question is, who should that third-party source be? There are different options available. That person could be known to the woman or to the couple who are trying to parent or co-parent, or that person could be an anonymous sperm donor. The anonymous sperm donor is the easiest one because there are very competent, safe sperm banks located in the United States that can be sources of the sperm, and you can go to the websites and get copious amounts of information, including videos of the donors, open donation, a selection of different donor characteristics, and you can feel very, very comfortable that that donor will be almost known to you even though their identity is anonymous. Many sperm banks allow an open anonymous donation where upon the child reaching a majority age, usually 18, they can ask the sperm bank to contact the sperm donor for a visit. That's the easiest source, and all it requires is the sperm to be transported to the IVF center, to the reproductive center, and then the doctor will pick the most appropriate reproductive technology, which might simply be a natural cycle. It might simply be thawing the sperm and putting it in on the most appropriate day. The sperm can be relatively pricey, so we want to make sure we're not wasting it. We want to do one sample to economize, and we want to make sure it's on the most fertile day of the cycle. When we have a lesbian couple, we have to decide who's going to want to be the parent. Well, that's usually the couple, but whose egg source is it going to be? Is it going to be the person who's going to be carrying the pregnancy, or is it going to be the wife or partner of the person who doesn't want to carry the pregnancy? So we commonly do something at RMA called co-IVF. Co-IVF means the person who chooses not to carry the pregnancy would be the egg source, and it would be fertilized outside the body through IVF with the donor sperm and transferred into the other member of the couple who wants to be the gestating or carrying parent. The choice is up to the couple. It's obviously much medically simpler to just inseminate one person 1 year and the other person at another time or together, but it is very interesting and intriguing to do the co-IVF, particularly if you need IVF anyway. If there is a reproductive problem where IVF would solve that problem, then co-IVF makes a lot of sense. One person becomes the egg source, the other person becomes gestating parent. And then oftentimes after the baby's born, the couple might switch and the embryos might go to the other party. Very, very simple, very straightforward. What about if you don't like the choice of an anonymous sperm bank? What if you want to know the donor? You have a relationship. You might want to co-parent with the donor. Well, a donor is then called a directed sperm donor. The government does regulate the appropriateness of donors from the perspective of not transmitting infections. So we do have to test the donor, even though it's somebody known to you, to make sure that you're not going to acquire any infections from the donor. But once the donor has been tested, that's certainly a viable option. We do recommend that the donor be quarantined. The sperm has to be quarantined for 6 months to be sure that the donor was not incubating any infections that didn't show up upon the immediate testing. And then 6 months later, when the donor is retested, then that sperm can be safely used for inseminating. So lesbian IVF, lesbian insemination, no different from anybody else. The only question is whose sperm source are we going to use? Well, what about the transgender community? What about gay men? Let's start with gay men. Gay men obviously are missing a uterus. they will have to use a gestational carrier. The term we use for the gay couple, the male couple who are coming to visit us, is that they're going to be the intended parent. Those sperm will be used to inseminate an egg from a donor. Same story as I mentioned earlier. It could be a directed egg donor. It could be a donor from an anonymous donor pool, and embryos will be created. Those embryos are then going to be transferred into a third person, or in the case of a gay couple, a fourth person. Gay men will be the intended parents, the egg donor, and then another person who will be the gestating person. That will be called a gestational carrier. So this is all very, very standard IVF. In this case, the couple who wants to be the parent have to be screened to make sure that this gestational carrier doesn't acquire any infections that they will know about from them. And once the couple has been screened and tested, then we would create the embryos and we would arrange the transfer into gestational carrier. So again, very basic IVF. With the transgender community, the right way to look at it is to see what body parts do you have. If you are a male and you have female organs, well, then the reproductive options would be a female. The one very important thing is that you need to get off your hormone replacement therapy because testosterone would prohibit pregnancy. Therefore, after about 6 months of stopping your replacement therapy, if you have female reproductive organs, then you can have standard fertility treatment. If you have a male partner, we use the male partner sperm. If you need an anonymous sperm, we use the anonymous sperm. What about the case of a transgender woman? Well, again, it depends on what reproductive organs she has. She may have still intact testicles and sperm production, and she might be able to provide sperm for the reproductive use. And then it would be the reverse, and we have to get eggs and somebody to carry the pregnancy. So LGBTQ fertility is standard fertility. The important thing is that we treat you the same as everybody else with the same respect and the same reproductive options. It's a matter of whose gametes you have, whose gametes we need to get, and who's going to be the person carrying the pregnancy. Thank you.